Okay, so I will talk, of course, about the operant self-administration model. So we are going to see how this operant model we can use for study chronic pain, but also how we evaluate these four different concepts that are reward, reinforcement, abuse liability, and addiction. We use rodents, in particular we use mice. It's very important to underline that this model for this particular behavior have a high translational value. Why? Because we are talking about similar brain structures involved in similar behavioral responses. We have a very well identified hippocampus in the mice, in rats and in mice. The functional role corresponds rather well with the functional role of the hippocampus in humans. The same from prefrontal cortex. Prefrontal cortex, of course, there are different classification of the subregions of the prefrontal cortex, but each one of these subregions is very well identified with the corresponding region of humans. And the same for the other brain areas that we are going to talk about involved in these responses, that are the nucleus accumbens and also the dorsal striatum. Similar function in rodents and in humans, nucleus accumbens mediating all the rewarding processes, dorsal striatum, all the motor behavior, automatization of this motor behavior. So let's see first the most simplistic model. How we can evaluate the most easy to evaluate in this abuse liability process, that is reward. Remember, reward means that you activate the rewarding circuit. You are able to produce pressure, to produce a positive feeling in your body. So how we can evaluate reward? For reward, we don't need the operant models. For reward, probably one of the most simplistic model, is not the only one, but one of the most simplistic model is the condition place preference. So what we do here? Imagine that we want to evaluate if morphine produces or not reward. What we do? We just take this apparatus, that is a condition place preference box, that have two different compartments communicated by a small corridor, and each one of the compartments have very different characteristics, have a different floor, have different doors, so the animal can very easily identify the compartment where he has been placed. So first, we start with a preconditioning phase. We open the door and we leave the animal to explore both compartments. Then we start conditioning. We start the first conditioning with morphine. So we close the door and we put here in this compartment the animal just immediately after morphine administration. So the animal is going to feel in the rewarding effect, the subjective rewarding effect of morphine, and the animal is going to associate the rewarding effect with this compartment, with the floor of the compartment, with the color of the compartment, with the characteristic of the compartment. Then we put our animal here to conditionate the animal to this stimulus, to a neutral stimuli to this compartment. And we repeat this conditioning. Classically, we repeat 4 times. 4 conditioning with morphine, 4 conditioning with saline. The next day is the testing day. You can imagine we open the door and you can imagine what the animal is going to do. The animal is going to stay in the compartment where he has received morphine. Why? Because the animal relates, associates the characteristic of this compartment with morphine, with the rewarding effect of morphine. He doesn't need to do anything else, just stay in the compartment, feeling, waiting the feeling of morphine that is not going to feel. So this is pure reward. What are the neuronal correlates of these opioid reward effects? Opioids, such as every single drug of abuse, opioids are able to enhance the release of dopamine, the activity of dopamine in the nucleus accumbens. And this enhancement in the release of dopamine in the nucleus accumbens is directly related to the rewarding effects of morphine or whatever drug. And why, how morphine increases dopamine here in the nucleus accumbens? Morphine is going to inhibit an inhibitor. GABA is the brake, is the inhibitor of dopamine. So the opioid is going to inhibit GABA, and so it's going to disinhibit dopamine. Remove the GABA brake, and you enhance the release of dopamine. This is very simplistic, and this is reward. But in operant models, we evaluate something much more complicated than reward. We primarily evaluate the reinforcing effects. That means the animal is going to act in an active way in order to directly obtain a rewarding stimulus. Understand that this is very different from the reward. This is reinforcing an active response to obtain at that precise moment the rewarding stimulus. So animal, of course, will self-administer all the drugs of abuse. And this model, we are going to see now, we can also use to evaluate the analgesic effects of a compound, how a compound is able to alleviate spontaneous pain. And this model also provides evidence about abuse liability. And then we are going to see that can also provide information about addiction. So what we do in these models? In this model is an operant model. There are an active lever and an inactive lever. And when the animal activates, presses the active lever, a light is going to be illuminated as a conditioned stimulus, and he's going to receive a reward that can be a food pellet. But in the case of drug of abuse, in mice, we usually use a nose poke because it's much more easy that the animal learn this behavior with a nose poke than with a lever. So when the animal enters the noise in the nose poke, he's going to receive an intravenous administration of the drug. And if you can imagine, if you put here morphine, cocaine, whatever drug of abuse, the animal is going to immediately learn to enter, to activate the active hole in order to obtain an intravenous administration of morphine that at the moment that the animal receives the intravenous administration of morphine is going to feel the rewarding effects of morphine. And it's going to repeat again the behavior because the animal likes morphine. So here, what will be the neurobiological correlate? Here is much more complex. You can imagine that a simplistic rewarding effect. Here first, you have, of course, the nucleus accumbens, because if there is no reward, there is no reinforcement. That's clear. Nucleus accumbens with the VTA projection, ventral tegmental area projection. But here also dorsal striatum is important for the perseverance of the response, the automatism of the response. And the animal is responding almost automatically. And what else? The hippocampus is important for remembering where he must press, how, when he must press, and also the cortical areas to promote an appropriate control of this behavior. And all these areas are integrated in order to obtain a response in this paradigm. So this complex paradigm can, of course, be used for studying analgesic compounds. And here, what we do is we induce chronic pain in a mouse, and we train the animal in this operant paradigm in order that the animal self-administer an analgesic compound to alleviate spontaneous pain. Imagine a mouse that is feeling chronic pain. You put in this box, and the animal receives an intravenous administration of an analgesic compound. The animal is going to press, is going to activate the hole in order to obtain analgesia, in order to alleviate spontaneous pain. And here, you can imagine very easily that you can dissociate an analgesic effect from an abuse liability, from a reinforcing effect. Why? because if you have an animal that suffers chronic pain and presses for the analgesic compound, he's receiving the analgesic effect. But imagine that the animal doesn't suffer chronic pain. It doesn't press, it doesn't activate the hole, means that the animal is going to respond only to obtain analgesia. But imagine that the animal doesn't feel pain and still respond here. In this case, you are producing a reinforcing effect. The animal is looking for the drug, not for alleviating pain. It's looking for the drug because the drug produces reward. This is the way to separate. In this model, you need an animal with chronic pain, an animal that doesn't have chronic pain, to separate analgesia from abuse liability. And so the procedure is you train the animal first to obtain food, because it's a behavior difficult to obtain. So the animal is trained to obtain food. You produce chronic pain. Classical model is a partial sciatic nerve ligation in order to produce chronic neuropathic pain. Make an intravenous catheterization of the mouse in order that the animal can receive the intravenous administration, and you train the animal in this operant behavior. So the animal that is suffering chronic pain will press the lever to obtain the analgesic compound. So it's a way of self-medication. And you can see, for instance, with pregabalin. Pregabalin, you know, is effective for treating neuropathic pain. So you have the shunt-operated animals, animals that don't have chronic pain, and animals that have chronic pain. You can see how the animal with chronic pain press much more than saline than the shunt animal. And the animal discriminate very well. So an animal with chronic pain makes very well the discrimination between the active and the inactive level. So an animal suffering from chronic pain is able to self-administer pregabalin to alleviate chronic pain, or because pregabalin produces reward. It's not so clear. The animal that doesn't suffer pain, he also self-administers pregabalin more than saline. So there is a tendency in this study that we already published, there is a tendency of pregabalin to produce rewarding effects also in control animals. But what is clear is that there is a very nice dissociation between the animal that has chronic pain and the animal that doesn't have chronic pain. The animal that has chronic pain self-administers much more pregabalin than the control animal. And he indeed alleviates pain. You can see that the animal that receives pregabalin alleviates pain, and also we evaluate the emotional manifestations of pain. Chronic pain produces emotional alteration, depressive-like behavior. Depressive-like behavior that we can evaluate in animals. And you can see here this depressive-like behavior, how this depressive-like behavior disappears in the animal that self-administers pregabalin. So this is a model of how an animal that has chronic pain is able to self-medicate himself, and this self-medication alleviates chronic pain and avoids the emotional manifestation of chronic pain. So what are we evaluating here with this model of self-administration? We are evaluating reinforcing effects, fully different from rewarding effects. And these reinforcing effects are related to abuse liability. Abuse liability is much more complex than reinforcing effect. Why? Because you start the consumption of a drug looking for the reinforcing effect, but you also maintain the consumption to avoid the negative consequences of the absence of the drug. And that's a little bit more difficult to evaluate in our model. We are now evaluating this first point, abuse liability due to the initiation of the consumption. So, but this is much more complex, maintenance, loss of control. So for what we are evaluating is a response. For the initiation, it's important this activation of the dopamine circuit, but remember that there is also adaptive responses during the activation of this reward circuit. This is a hedonic scale. Under normal conditions, we are now on 0. We are not in a situation of reward. We are not in a situation of aversion. If we start the consumption of a drug, we are going to have rewarding effect. We are going to have an hedonic feeling. And hedonic feeling that is maintained during the period that the drug is in our body. When the drug disappears, we feel a little bit bad, and suddenly we return to the normality. Somebody that drinks a lot of alcohol during the night, the next morning is not on 0, it's a little bit down, and then it returns immediately to 0. But what's happening if we repeat and repeat again and again the consumption of the drug? There are two very important adaptive responses. First, tolerance to this hedonic rewarding effect, sensitization to these negative consequences. So from this, the starting point, we pass to this other one. When the addiction process has already developed, the person consumes the drug, the person that has developed the addictive process, he still feels rewarding effect, but much less than before. But at the moment that the drug disappears, he becomes in a profound negative state, a profound aversive state. And the reason for consuming again is not for obtaining the rewarding effect, not. It's for avoiding these negative consequences of the absence of the drugs. And this is very important. You start the consumption looking the rewarding effect of the drug. You maintain the consumption to avoid mainly the negative consequences of the absence of the drug. Of course, that have completely different correlates. Why there is these negative consequences of the absence of the drug? First, because in the rewarding circuit, in the nucleus accumbens, we have just the opposite change than during drug consumption. We have a profound decrease in dopamine levels. And we also have in the amygdala the activation of all the stress circuits. CRF and other stress mediators are overactivated at the moment that you don't consume the drug. So here you start to implicate different circuits just to obtain these negative consequences that are due to the absence of the drug. But finally, probably the most crucial in the addictive process is the loss of control. The loss of control that leads to a compulsive search of the drug and to a relapse after very long periods of abstinence. And why there is this loss of control? So here, the crucial brain structure for the loss of control is the prefrontal cortex. Remember that the prefrontal cortex has bidirectional connection with the limbic system and provides all the rational control of the behavior. And whatever we do in our life, we have this control between the emotional response of the limbic system and the rational response of the cortical area. And the appropriate control of these two brain areas is responsible of a normal behavior. What's happened during drug addiction? During drug addiction, there is a profound change in the cortical areas, mainly in the prefrontal cortex. You can see here the activity of the prefrontal cortex in a normal subject and the activity of a prefrontal cortex in a cocaine addict. I put the example of a cocaine addict, but whatever drug that you want, you have exactly the same change. Alcohol, cannabis, heroin, nicotine, whatever. You always have, at the moment that you develop the addictive process, you have this dramatic decrease in the activity of the prefrontal cortex. So the capability of this person to a rational control of the behavior is completely impaired. It's impossible to explain to this person that is rational, that don't consume the drug, because this person is unable to take a rational control of the behavior. There is a profound change on this cortical area that today is recognized as probably the key change to understand this addiction process. And in this cortical area, there are really profound changes. This is an old study that we published where we observe that there are major changes even in the dendritic ramification of the cortical areas. You can see an animal that receives chronic saline or an animal that receives chronic cocaine, and you can see that a chronic cocaine administration produces a major change in the dendritic fields of the cortical area. So you are producing really morphological changes in these cortical areas that are probably related to this loss of control, to this inability to take a rational control of the behavior during the addictive process. But the addictive process is more complex. We started with these rewarding effects. Then there are these negative consequences of the absence of the drug that play a major role. Then there is the key issue, loss of inhibitory control in the cortical areas, and this habit formation. You start to consume the drug just to obtain the reward, but later these responses don't activate only the nucleus accumbens. They become dorsalized. They start to activate the dorsal striatum. What does mean? That means that something that you do because you want to obtain the reward finally becomes an automatic response mediated by the dorsal striatum. So look the complexity of the addiction. Is it possible to have a model of addiction in animals? The answer is yes, and I will finish with that, with a model that we and others have established just to evaluate addiction in animals. For addiction, we need to evaluate basically the three most important criteria that summarize the concept of addiction in DSM-5 are the persistence to respond, the inability to stop seeking the drug. A person addict is unable to stop to seek the drug. The second is the motivation. The drug is the center of the life. Nothing else exists in an addict. The whole life is looking for the drug. And the compulsivity. Compulsivity means I consume the drug is going to produce negative effect. When I consume, I don't care. I still consume. I consume in spite of the negative consequences. How we can evaluate this in an animal? Persistent to response. The animal cannot stop seeking for the drug. In this operant behavior, you have 25 minutes that the system is active. Then, during 10 minutes, the light is off, so the animal understands that it doesn't work to press the lever because it's not going to receive any reward. These 10 minutes, the animal, whatever he does, doesn't receive any reward. So you can imagine that an animal that is unable to stop to seek for the drug still press the lever during these 10 minutes. And we have animals was pressing 600 times, once per second. Imagine the complete loss of control. The animal is unable to stop to seek for the drug. Then motivation. We use the progressive ratio. What does it mean? It does mean that to obtain the first dose of the drug, the animal must press 1. To obtain the second, the animal must press 2 times. To obtain the third, 5 times. So the animal needs to make an effort each time higher in order to obtain the reward. And here we evaluate the breaking point. What's the maximum effort that the animal does in order to obtain one single reward? And the numbers that we obtain are really crazy. There are animals pressing 1,000 times in order to obtain one single reward. So there is a motivation extreme for the reward. Imagine a mouse pressing 1,000 times in order to obtain a single reward. And then how we evaluate compulsivity, how we evaluate consumption in spite of the negative consequences. We use a fixed ratio 5. Fixed ratio 5 means in order to obtain the reward, you must press 5 times. You press 5 times, you obtain the reward. Well, but here no. Here, when you press the 4th time, the animal receives a food shock. And when the animal presses the 5th time, receives another food shock and then the reward. You can imagine That a normal animal is not going to resist 2 food shock in order to obtain a single reward. An animal that has a compulsive behavior, doesn't care about the negative consequences, is going to do it. So these are the 3 criteria that we evaluate in animals. And the protocol are really very long. These are very complex protocol of addiction. The classical protocol, for instance, that we use is for a period of 4 months. And we develop the addictive process at the end, after 100 days of training. And here is when the animal has this maximum persistence, cannot stop. It has this maximum motivation and press whatever receive or not the food shock. And here, something also interesting is some animals develop addiction, others not. Here we can really separate those that due to individual vulnerability is able or not to develop addiction. As you can imagine, I finish with that, complexity of the brain structures involved in this addictive behavior is really impressive. We are not talking only about VTA nucleus accumbens. We are not talking only about hippocampus, amygdala. We are talking also about the involvement of these cortical areas, of these complex circuits that control the reward, control the inhibitory control the stress circuits, and control the memories. These are extremely complex behavior that are responsible for the development of a disease that is called addiction. Thank you.